My question is to the Minister of Health. Is the Minister aware that this study that he referenced in QWA 13827, one of only two that he told me he was keeping a watching brief on for evidence about a sugary drinks tax, has not been published in a peer-reviewed journal and has been described by a reputable science and medical journal as industry-funded?
Now, it may have been industry-funded, but I've also sought advice from the Ministry of Health, and they state that it doesn't add any new evidence to the debate about whether to introduce a sugar tax. And they also go on to say that while there was an initial report of up to a 12% decline in sugar-sweetened beverage sales in Mexico following the introduction of a tax, those reports failed to control for other factors likely to have contributed to declining sales, including active public health and education campaigns and improved access to safe drinking water.
Does he stand by his statement about a sugary drinks tax in the House on 13 October that, quote, "I have talked to the Chief Science Advisor extensively about this, and he admitted that there was no clear evidence on the subject"?
The Honourable Dr. John Coleman.
Can he confirm that the advice he received from the PM's Chief Science Advisor on 3 July this year actually said, quote, "From being sceptical of the value of sugar-sweetened beverage taxes and their impact on consumption, recent evidence suggests a surprisingly, to me at least, large and sustained effect, particularly in groups most at risk of obesity"?
No, I obviously can't confirm that because I haven't got the document, but there's no reason to disbelieve anything that the member says regarding to that quote.
Does he accept the findings of the recently released peer-reviewed published study, also from Mexico, showing that the sugary drinks tax has modelled a reduction in nearly 200,000 fewer cases of type 2 diabetes, over 20,000 fewer strokes, and 19,000 fewer deaths, as well as saving its health system nearly $1 billion over the next decade?
No, I haven't seen that study, and you'd have to look at the methodology and read the study fully. But what I've said to the member many times before is that there's a meta-analysis of all the evidence on a sugary drinks tax, which will be available next year. It's being done actually. There's two different centres. One is University of Waikato, one is University of North Carolina, and I'm always open to considering the emerging evidence. But just plucking random quotes out of studies and presenting them in Parliament, frankly, that doesn't tell anyone anything.
Will he now commit to investigating a sugary drinks tax here in New Zealand, given the overwhelming weight of peer-reviewed, published scientific evidence that a sugary drinks tax will protect the health of our children? Or will he continue to believe the non-published, non-peer-reviewed, industry-funded research, which calls into question the overwhelming weight of evidence?
Look, I wouldn't advise anyone to do anything on the advice of a few quotes from Julianne Genter presented in the Parliament, quite frankly.